let's dive into some exercises for the soft tissue around the wrist to make it stronger, more durable, and more functional, both for every day and for all the activities you like doing. First and foremost, though, let's remember that when there are bone issues going on, whether it's an ulna that's too long or a knee joint that's bone on bone, very often those only end in invasive procedures like surgeries, because there isn't a lot of other stuff we can do for a bone. But there's a lot we can do for the soft tissue surrounding the joint, the bone, the area of the body that we're trying to make improvements on. So whether you're trying to avoid having to have an invasive surgery, whether you're after an invasive surgery, or you're trying to avoid it but you're like not really sure it's actually going to work out, no matter where you're at on that spectrum, it's always good to make your soft tissue as durable, strong, and functional as it can possibly be, so that you're more equipped to handle if a surgery does happen, and you can bounce back quicker if you do end up having to do it. And in a lot of cases, like myself, you can actually avoid surgery altogether. So where you land on that spectrum, apply the stuff we're going to do here. Now remember from previous lessons, the way we influence our soft tissue is through our nervous system, our brain, our spinal cord, and our nerves. That is the number one thing that changes how much mobility we have, how our soft tissue feels, how it functions, and how strong it is. So if we aren't imparting some kind of input to the nervous system, we're not going to get a lot of feedback out of it. That's, remember, a lot of the reason why passive stretching doesn't do a lot of good in terms of making lasting change for mobility, range of motion, control, or strength. We always want to input some kind of signal, which you're going to do in all these drills. Let's dive in. So first and foremost, we always want to be staying in pain-free ranges, which means if you go into a position, if I go like this with my arm and it hurts, I only should go to the point where I still don't feel pain, but it's like the last spot where pain would present itself. Big reason we want to do that is because we want to teach our brain that it's safe to move through ranges of motion. And if your pain receptors keep getting fired and your brain starts picking up on that, which of course it will every single time because your brain's trying to keep you safe, it will disallow that movement and you'll have a harder time. So we always want to work in pain-free ranges of motion. So for example, first drill to do to work on the TFCC and all of the tissues around the wrist, really. And there's a little fly who has joined me for this lesson, so if you see him buzzing around, that's who that is, I guess. First thing we're going to start with is positional isometrics for every single point around the wrist. A positional isometric is just a fancy word for doing an isometric contraction in a position. So I guess it's not even that fancy. But what you're going to do is, we all know that like the wrist should be able to make like a circle, right? So imagine that circle going all the way around your wrist, and what you're going to do is pick points all the way around the circle. You'll probably, with TFCC stuff, want to favor the outer portion of the circle, but don't neglect the inner portion either. The positional isometric goes like this. So let's say I just kind of get my arm down. You can put your hand on a desk, especially when you're early going and kind of everything is achy and hurting. Find a position of ease so that you can get the most out of the practice. Because if you're just like kind of tense and tight the whole time, it's going to be hard to make any progress. So exercise number one, find points on the circle that your wrist makes, perform a positional isometric. Here's how you do it. So, okay, if I've got my arm out, I'm going to work on the point that's right out here. So I'm going to go to the point with my hand. See that wrist motion? See how I'm bringing my pinky towards the outer portion of my forearm? That's the wrist motion. I'm going to go to the point where I feel good. There's no pain. So in the early days of my TFCC stuff, that was like that much. I couldn't move much without it causing pain. These days it's quite a bit further. I have full range and it's all good. So I'm going to find that spot, whether you put your arm out on a table or you bring it down next to you. You're then going to take your other hand, and your hand is going to try to push the hand that is doing the work back the other direction. The tissues right here in your wrist are going to resist that. That's where the isometric comes in. Remember that isometric means no movement. So it's kind of like if someone's like, hey, make a bicep curl, and you go like this, right? You didn't move the bicep, you just flexed in what we kind of always think of as like the beach muscle pose. You're going to do the same thing here. So to do that, let's actually do a rep together and kind of walk through how it goes in terms of process. So I'm going to find the spot where I have no pain, and I go, okay, that spot's really good there. I can already feel these tissues out here starting to do a little contracting. So now I'm going to take this other hand and try to push this hand back this way This hand, not gonna allow it, and that's gonna be these tissues working right here. So I'll place the hand there. I'm gonna start trying to push on this working hand, this guy down here. Slowly, I'm gonna ramp up the intensity of that. So at first, my pushing is like a 10% on a total scale of 100%. Then I'm gonna go to 20%, then 30, and I'm gonna try to work my way up to about 80%. So a nice, strong contraction. So I'm gonna start pushing. Remember, you can't see anything happening, but this guy is driving that way, this guy is driving back this way. And I feel all these tissues here contracting. You can probably even see the muscle flexing. I'm gonna hold that for 10 seconds once I've gotten to 80%. And then I'll slowly reduce the intensity and relax back to normal. Then I'll go to the same position again and go to the other side. So now I'm gonna be working these tissues over here that are a lot longer. These tissues were really short, they're really compressed. These tissues are a lot longer because everything works in opposites. So we're then gonna work on those long tissues, same exact thing. This hand now is going to be trying to resist this hand from coming back. So I'm trying to resist my thumb from coming towards my inner portion of my wrist. So I'm gonna slowly start ramping up the intensity. However much this working hand is trying to push this way, this hand is meeting it and keeping it right where it is. Once I get to my 80% mark, I will hold for 10 seconds at that intensity. And then I'll slowly let off the gas, kind of like when you're slowly braking a car. You don't want to smash on the brake. You want to slowly ease onto it and come to a full stop. Same with your isometric contraction. You'll slowly ramp down or relax out of that 80%. So that alone will be tiring for a lot of folks who are dealing with issues around here, because these tissues are likely have been weak for some time or compromised in some way or injured in a lot of cases, and so they're not having had a lot of practice and training at being really strong. So take your time with that. You'll start with 3 reps and build yourself up to 5. Okay, and again, no rush to build yourself up to 5. That alone is quite fatiguing, and that's only exercise 1. And so then from there, exercise 2 is, so I just did this point on the circle, but if I'm doing a wrist circle, I could also work on this point in the circle, or this point, or that point, or that point. Let me just give you an example of how to resist yourself in all of these points. No matter where you pick a point on the circle that your wrist can make, remember, pain-free only. Let's say I want to work here. You just resist yourself from the shorter side. You see how this is shortening here and how the opposite side is longer? And now if I go like this side is shorter, this side is longer. Those of you who remember geometry class, look for your angles. We're looking for the more acute angle, and then it's opposite, okay? So let's say I pick this angle here. The way I'd resist myself is from the top. This hand is trying to push this guy down. This hand is contracting these tissues to not let that happen. Then the opposite would be hand here. And again, however you want to position yourself is totally fine. Just find something that you can tolerate. Then this hand would be trying to resist the fist from pushing down, so that you use these tissues. Let's say I want to pick this angle right here. So it's kind of this like diagonal angle. Well, I can resist myself coming up this way, so the knuckles are trying to come up towards my midline of my body, and the hand is going to resist that. And then I can put the hand on the other side, and I can try to bring my hand across that diagonal line. This guy resists it. So really, you're trying to bulletproof that whole circle with isometric contractions. All of them are a 10-second hold. Once you reach whatever your version of 80% of your maximum safe contraction is, you always slowly ramp up and you always slowly ramp down, and you start with 3 reps and you move to 5. Then from there, we go into actual wrist circles. So whether you put your arm at your side or your arm out, or if you want to put it like way out there, whatever you want to do is fine. But without moving your forearm, and often taking something, this is a big block, I probably wouldn't use something this big normally. I have my lav mic box. You could put like that on your forearm, or a phone. Putting something on your forearm will clue you in to how much your forearm moves when you're doing, this is so big, let me use the little guy. How much your forearm moves when you do wrist circles. So if I do the wrist circle, and all of a sudden my object falls off, I know that I've actually not rotated my wrist. I've actually flipped my entire forearm over, which is not the wrist. We want our motion to be isolated to the wrist only because remember, like we talked about in previous lessons, individual joint function before integrated joint function. We want each joint to work as its own standalone feature before we integrate it with the rest of our body. So when you put something on your forearm, make it tricky on yourself, and you go to make your circle, you get this great feedback about what's actually wrist motion and what's actually, like let's say I go here, forearm motion. I started to move this guy. But all in, your circle will be whatever amount of motion you can make with a closed fist without moving the forearm and without bringing the elbow out to the side, all with a closed fist, each direction. Start with 3, build yourself up to 5, and then with an open hand. And with an open hand, you're trying to keep that wrist in the same spot and keep your hand straight the whole time. So it's often quite tempting to do stuff like this. You see how my knuckle bends? It's tempting to do that, but what we want to do is circle around like that. And again, just like the isometric drill, you want to only work in pain-free ranges. So when I was healing my TFCC strain and injuries and stuff like that, my circle wasn't quite a circle, because when I got to about here to go around, it like hurt, and my brain was like, nope, and I knew we needed to stay in pain-free ranges. So instead, my circle was a bit more like kind of lopped off that side. Then I would do a nice big circle, and then I'd lop off that side, and slowly over time, as I did more of the isometrics and more of these wrist circle drills, I was able to slowly start breaching into that range that used to have pain because it didn't anymore, and I could slowly start expanding from there. Okay, so that's the second exercise. So you have a whole bunch of positional isometrics around that circle to do, the wrist circles to do, and then lastly to work on wrist extension and flexion. And we're going to use an isometric to do that as well. So on the floor here, I think we're all pretty familiar. Actually, let me bring you down here. There we go. I think we're all pretty familiar with these kinds of stretches. If not, it's a way to stretch your wrists and do it passively, but it's not an active input, so your nervous system doesn't learn much about what it's supposed to be able to do with that. We want to input an active input to the wrists and the tissues. So what you'll do is go down on the floor and lean forward. This is wrist extension, by the way. Lean forward to the point where you're like, either it hurts, so we aren't going to go past, and we want to back off a little bit, back into that pain-free range, or you feel a big stretch, and you don't feel any pain, but you're like, that's enough of a stretch. So that might be really far forward. For a lot of folks dealing with TFCC stuff and forearm stuff, it stops a bit sooner. Find where yours is at, and then what you're going to do is start to contract the tissues on the top of your hand and finger and up your forearm. And you're going to try to maintain this exact angle and peel it off the ground. So check it out. So let's say, okay, cool, that's my spot. Anything more than that kind of hurts. I'm going to start contracting the tissues on the top of my hand, finger, and forearm. And then I'm going to try to maintain that angle as I lean back. And I'm going to hold that for a 5 count and then relax. And then I'll try to go again. Contract all those tissues on the top of my hand. Again, pain-free only, so you might have to go slow. Start leaning back, trying to maintain the angle you had when you were just passively hanging out over your hands, then relax. Here's an example of how, when it doesn't go properly, what you can see and what you'll see happen. So let's say I'm there, I'm like, okay, cool. So I see that it's just about like a right angle here, so I'm gonna try to keep that right angle. And you go to start contracting those tissues all up through here, and you're like, okay, I'm gonna keep that right angle, and you start leaning back, and your tissues don't really bring your hand with you till right about there, okay, or somewhere past that. The goal was to keep them flexed at 90 degrees, like that, not to only be able to start pulling them with you when you had a more open angle than 90 degrees. That's okay if that's the case. It just indicates some opportunity to improve the strength and control of the tissues that do wrist extension. And so by practicing, again, start with 3, work to 5. That's kind of the basic for when someone's working out of pain stuff, just to do things that aren't too voluminous for the body at that point. And depending on where you're starting from, you may need to do even less simply because you're at that point in your healing career. So that's the wrist extension one. Then the wrist flexion one is the same concept, but you put your hands on the ground like this. You could do this on a table too if sitting on your knees doesn't work for you. And so you can put your hands down on the ground, and maybe that is enough that you're like, too much. In which case, you just fold over a little bit. You see how when I do that, I don't have as much of an angle on my wrist. Now it's really flexed. Now it's less flexed, okay? So now what I'm gonna do is flex all the stuff on the back of the forearm, bottom of the wrist, and into the hand to try to maintain that angle as I lean forward instead of leaning back. So in my case, right here sounds good. Yep, I feel a nice stretch. I'm gonna start contracting so you can see the angle I've got. I'm gonna try to maintain that as I lean forward. Hold for 5, then relax back, okay? It was a little bit of a short 5, but you know what I mean. I'm gonna squeeze here, ramp up that contraction, lean forward, hold for 5, bring it back. If that's too easy, make it harder on yourself by making the wrist angle smaller. So you're in more flexion now. Start contracting, see if you can maintain that, lean forward, hold for 5, and go back. Okay, so with those couple of drills, you'll be able to start doing some good work on your wrist and TFCC and forearm and hand and all that good stuff. Give it a try. Let me know how it goes. See you again soon.